I'm Matthew Katz. I'm a assistant professor of surgical oncology at the University of Texas MD Anderson Cancer Center. I am a full-time pancreas cancer clinician and researcher, and I'm pleased to present this talk today where I hope to give some general overview of pancreas cancer and particularly resectable pancreas cancer, which is in my purview as a surgical oncologist. So I have three primary objectives with this talk. The first will be to provide, again, a brief overview of both the pancreas and pancreas cancer. Second, to describe the system that clinicians use to stage this disease. And then finally, to discuss the treatment of resectable pancreas cancer with particular attention paid to surgical therapy as well as adjuvant or non-operative therapies, and I'll describe what those are later in the talk. So the pancreas is a soft organ that lies underneath the stomach in the upper abdomen. And the pancreas is actually a gland, which means that it's an organ that secretes chemicals. And in this case, the chemicals that the pancreas produces both help the body digest food and regulate glucose metabolism. The pancreas lies deep within the back, or what's called the retroperitoneum, and this deep location within the abdomen is in part responsible for the delay that is characteristically associated with the diagnosis of diseases of the pancreas. In the left diagram, you can see the pancreas itself. It's a strange-looking organ that is surrounded on its left side by the first part of the small intestine and is also intimately approximated to the vessels that supply the liver, small intestine, and large intestine. The pancreas has a single major pancreatic duct, which is used to bring digestive juices from the pancreas into the small intestine to help digest food. And then there are scattered cells throughout the pancreas which produce certain chemicals that aid in the metabolism of glucose. On the right, you can see a general schematic of the organs of the abdomen. In the upper aspect of the abdomen, you can see in red the liver, and then underneath that, the stomach, which is yellow. You can't actually see the pancreas because it, again, is in the back, and it's actually behind the stomach. So again, the pancreas has two primary functions. The first is an exocrine function, that is to digest food, and the second is an endocrine function to help with glucose metabolism. The pancreas secretes digestive enzymes into the first part of the small intestine, which then mix with the food as the food comes down from the stomach, and these chemicals, these digestive enzymes, help break down the food so that nutrients can be absorbed in the small intestine. The endocrine cells, which can be seen in the lower right aspect of the diagram in multiple colors, are cells that produce chemicals such as insulin, which most people have heard of, and other cells such as glucagon and somatostatin, which fewer people have heard of, but are as important in regulating glucose metabolism and the metabolism of other aspects of body function. Failure to perform these exocrine and endocrine functions can occur when the gland is taken over by cancer cells, and this failure can produce some of the characteristic symptoms and comorbid conditions, such as diabetes, that are associated with pancreas cancer. I want to discuss a little bit about cancer in general before I discuss pancreas cancer. Cancer develops at the single-cell level, and essentially it involves dysregulation of cell growth in which a single cell becomes mutated and starts dividing faster than normal. And unlike normal cell division, this division is both fast as well as unregulated, and it's essentially unstoppable. And the growth of these cells develops into the primary tumor. And so for pancreas cancer, the primary tumor develops secondary to unregulated growth of a certain type of cell that lies within the normal pancreas. Once the tumor has gotten to a small size, it's supplied with blood vessels from the body, as seen in Part B. Once the tumor becomes big enough, cells from the primary tumor can invade into the vasculature of the pancreas in this case, and then circulate throughout the body, pumped by the heart, and these cells can lodge, take up residence in distant organs, such as the liver or the lungs, and these new tumors are what are called metastases, as opposed to the primary tumor, which again, in this case, is in the pancreas. So for pancreas cancer, we're often dealing with multiple tumors or multiple nodules, the primary cancer or tumor being located in the pancreas itself, as seen on the left figure, and then a metastatic deposit, such as the one depicted here on the right, which has developed in the liver. And in this case, while the tumor in the liver is cancer, it's actually not liver cancer, it's pancreas cancer that has traveled from the primary tumor in the pancreas to develop within the liver. So there are multiple types of pancreas cancer, and the different types of pancreas cancer are determined by the initial cell that becomes mutated and starts all this unregulated growth and expansion. The pancreas, again, as you can see in the figure on the right, is composed of ducts and acini, which produce these exocrine digestive enzymes on the top, and then on the bottom it is also composed of cells which are responsible for the production of hormones involved in glucose metabolism. When the cells of the pancreatic ducts become cancerous, they develop into a cancer called ductal adenocarcinoma, and this type of cancer is quote-unquote true pancreas cancer, or the type that people think of when they think of pancreas cancer. And this particular type is responsible for about 90% of cases of pancreas cancer. But there are some other types, such as neuroendocrine carcinomas, which can occur when the hormone-producing cells become malignant, or acinar cell cancers, which occur when the acini become malignant, or even other types of cancers which begin in other less frequent cells scattered throughout the pancreas, such as squamous cell cancer or embryonic cancers that occur primarily in children. So there are a number of different types of pancreas cancer, but what I'm going to limit my talk to today is essentially pancreatic ductal carcinoma, which accounts for 90% of cases. So pancreas cancer is a notoriously deadly disease. This is a slide from the American Cancer Society, which shows the leading sites of new cancer cases and deaths in the United States in 2011. On the left aspect of the table are the estimated number of new cases of various types of cancers in both men and women in 2011. And on the right aspect of the table are the estimated number of deaths in 2011 in both men and women by the most common cancers. Pancreas cancer is outlined in red, and what you can see is that it's the 10th most common cancer among both men and women each year, but it is the 4th most common cause of cancer-related death. And equally as important is that the number of new pancreas cancer cases each year is about equal to the number of pancreatic cancer deaths per year. So clearly this is a disease that is very difficult to manage, but for a distinct group of patients, proper timely therapy can be curative. And I'll explain more about who these patients are and how they can be treated in the remainder of the talk. This is another slide from the American Cancer Society showing trends in 5-year survival. So these are 5-year survival rates of patients with a variety of different cancers. And the table depicts the 5-year survival rates of patients who were treated in each of 3 time groups. The first group between 1975 and 1977, the second group between 1987 and 1989, and the last group in the more recent era of 2001 and 2007. And the numbers below each of those time periods indicate the percent of patients diagnosed with each type of cancer who lived for 5 years or more following diagnosis. And what you can see is that pancreas cancer survival rates are quite low, and in fact the lowest of the cancers reported here. And I think even more alarming than the numbers themselves is the fact that the numbers have not increased or improved over the past 40 years. So whereas the 5-year survival rate in the 1970s for patients with pancreas cancer was 2%, we are still, 40 years later, at a 5-year survival rate of 6%. So there's clearly a lot of work to be done in this area. And I can assure you that as clinicians and researchers, we are hard at work trying to change these numbers.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support.